Welcome to today's lecture on the topic of nicotine addiction and smoking cessation. In this detailed script, we will explore various aspects of nicotine addiction, including its neurobiology, genetic factors, pharmacological interventions, psychological therapies, and societal implications. By the end of this lecture, you will have a comprehensive understanding of the complex nature of nicotine addiction and the strategies used to help individuals quit smoking. Nicotine is the addictive substance in tobacco. It binds to nicotinic acetylcholine receptors in the brain, causing the release of dopamine, norepinephrine, and serotonin. This enhances the pleasure and rewards of smoking and contributes to nicotine dependence. Genetic factors play a significant role in determining an individual's vulnerability to nicotine addiction. Research has identified several genes associated with nicotine dependence, including those involved in nicotine metabolism, receptors, and transporters. For example, variations in the gene coding for the nicotine receptor subunit alpha-5, CRNA5, have been linked to increased nicotine dependence. Understanding the genetic factors that influence nicotine addiction can help personalize treatment approaches by identifying individuals who may benefit from specific medications or interventions. Genetic testing can provide valuable information about a person's genetic variations related to nicotine addiction, allowing for targeted interventions and personalized treatment plans. Additionally, genetic research may further our understanding of the underlying mechanisms of addiction and help identify potential new targets for medication development. In summary, nicotine replacement therapy, NRT, helps individuals quit smoking by providing a controlled dose of nicotine without the harmful chemicals in tobacco smoke. NRT works by reducing cravings and withdrawal symptoms through various forms such as gum, patches, inhalers, and nasal sprays. The choice of NRT depends on individual preferences and smoking habits. In summary, cognitive behavioral therapy is a psychological approach that helps individuals modify thoughts, beliefs, and behaviors related to smoking. It helps challenge maladaptive thought patterns, develop coping strategies, and maintain long-term abstinence from smoking. Bupropion and varenicline are FDA-approved medications for smoking cessation. Bupropion works by reducing nicotine cravings and withdrawal symptoms, possibly by affecting dopamine and norepinephrine neurotransmission. Varenicline acts as a partial agonist of nicotinic acetylcholine receptors, reducing nicotine cravings and blocking the effects of nicotine if a person smokes. Understanding the pharmacokinetic properties of these medications is important for dosing and monitoring for interactions or side effects. The prevalence of dual use, or the simultaneous use of electronic cigarettes, e-cigarettes, and traditional cigarettes, has increased in recent years. Understanding the patterns of dual use and its potential risks is essential for developing effective interventions. Dual use of e-cigarettes and cigarettes can vary considerably, ranging from occasional use of e-cigarettes in situations where smoking is restricted to regular use of both products. Some individuals may use e-cigarettes as a smoking cessation aid, while others may use them alongside cigarettes without intending to quit. Research suggests that dual use may hinder smoking cessation efforts and may even be associated with increased nicotine dependence. Additionally, the long-term health effects of e-cigarettes are still being studied, and concerns exist regarding their potential impact on respiratory and cardiovascular health. Addressing dual use requires a multidimensional approach, including education about the potential risks of e-cigarettes, counseling individuals to quit smoking completely, and exploring alternative cessation options. Exposure to secondhand smoke can trigger cravings and increase relapse risk among those trying to quit smoking. Smoke-free environments, education on triggers and consequences, counseling, and coping strategies can help mitigate this risk. In summary, mindfulness-based smoking cessation programs integrate mindfulness practices with traditional cessation methods to improve self-awareness, emotional control, and relapse prevention. This approach helps individuals understand their smoking patterns and develop healthier coping strategies, leading to decreased smoking rates and improved quitting outcomes. Smoking cessation is essential during pregnancy due to harmful effects on fetal development. Adverse outcomes include premature birth, low birth weight, stillbirth, SIDS, and developmental abnormalities. Counseling, pharmacotherapy, and social support are effective interventions, with healthcare providers playing a crucial role. Quitting smoking is crucial for COPD patients, but it presents unique challenges. Tailored approaches, such as pulmonary rehabilitation and pharmacotherapy, can help manage withdrawal symptoms and provide support during the quitting process for these individuals. Primary care providers are important in helping patients quit smoking. They can screen for tobacco use, give brief counseling, and refer patients to specialized resources. This approach can improve quit rates and reduce smoking-related diseases. Tobacco advertising regulations are important in reducing smoking rates and promoting cessation. These policies restrict advertising, limit product placement, and include warning labels on packaging. Regular evaluation and revision of regulations are necessary to support cessation efforts in public health. In conclusion, understanding the complexities of nicotine addiction helps tailor treatment approaches. Pharmacological interventions and psychological therapies aid in smoking cessation. Special populations require individualized care. Integrating interventions into primary care and implementing advertising regulations promote healthier behaviors. By expanding their knowledge, healthcare professionals improve patient outcomes and public health.